So we'll start on our backs, and there's a couple of different ways you can lie on your back. You could take your legs up and over a chair, or you could take something underneath the backs of the knees. I'm going to take a bolster underneath the backs of my knees. Sometimes coming down to the back at first it can be a little jarring, especially if we're used to sleeping in a soft bed. So this is just a way to kind of help the lumbar spine ease onto the back. And as you lie down here, take a few moments to kind of move the shoulders away from the ears, slightly tilt the chin towards the chest. Find a comfortable position to rest your arms. And just notice how your neck feels. Notice how your shoulders feel. And take these first few moments to close the eyes. Notice the breath. Just get a sense of how you're feeling today, what the body feels like physically, energetically, and emotionally. Take a big breath in through the nose. Open your mouth, exhale the air out. Deep breath in. Open mouth, exhale. Gently seal the lips, start to take the air in and out through the nose. On your next inhale breath, stretch your fingertips up towards the ceiling. Let your palms face one another. Get a sense of your shoulder heads plugging back down into their sockets. Cross your right elbow in front of your left. Bend your elbows, grab your opposite shoulders, so it's like you're giving yourself a big hug. Move the elbows so they're pointing up towards the ceiling. And that right bicep might hover over the mouth. Take a deep breath in. Take a deep breath out. Notice how this feels on the back of the shoulder. It might feel intense. It might not feel like much of anything at all. There's no supposed to, it's just you noticing how your body feels. There's no right or wrong. Settle back into the breath, in and out through the nose. And take your breath all the way down to the belly. A few more breath rounds here. Again, to release, extend the fingertips back up towards the ceiling. The palms are facing one another. Sweep your left elbow in front of your right. Bend your elbows, grab your opposite shoulders. Second side, elbows are pointing up towards the ceiling. As you settle the weight into the back of the shoulders, release any gripping in the fingertips, in the wrist, in the elbows and the shoulders. Let them be heavy. And take a moment to observe how this side might feel really different than the first side. A lack of sensation or an intensity of sensation. Perhaps somewhere in between. Coming back to your breath. To each inhale, can you take the breath all the way down to the belly? With each exhale, let it be slow. Back out through the nose. Right now your shoulder blades are in a protracted state. They're moving away from this body. They're spreading away from the spine. Notice how this closes off the front of the chest. As the upper back spreads. A few more deep breaths here. Next breath in, and re-extend fingertips towards the ceiling. Let the palms face one another. Take your exhale, elbows out wide to the sides, so you're making a goalpost shape with the upper body. Relax the backs of the hands on the floor. And now there's a slight movement of the scapula in towards the spine. They're retracting. And this broadens the chest and collarbone. Take a few moments here to breathe into the belly, breathe into the heart space. Take 3 long, slow, deep belly breaths here. We'll begin to bend the knees one at a time, plant your feet, and if your knees were resting on a prop, you can just rest your feet on top of that prop. So the knees are pointing up towards the ceiling. Press down into your feet, scoop your tailbone up and under, and then reset your low back and your tailbone down. Take a few moments here to rock through the pelvis. So on your inhale, the tailbone presses down into the floor and the low back lifts away from the floor. On the exhale, the tailbone scoops up and under as the low back presses down. Inhale to arch the low back. Exhale to flatten out through the low back. Really, really small movement. You're only moving the pelvis a few inches, if that. Just noticing how that feels on the hips, on the pelvis, on the lumbar spine. Couple more times. So release that motion, and then if you have your feet on that prop, you can move the prop kind of down so that you can plant your feet flat on your mat. Pick up the right foot, extend it towards the ceiling, the sole of your left foot still planted. You can interlace your fingers behind the right thigh. Begin to point and flex the right ankle, circle out the ankle, just find some movement. Rebend your right knee, hug it into the chest, give it a little squeeze. Flex your right foot, place that right ankle on top of the left thigh, kind of close to the knee joint. So you're making a figure 4 shape with the lower half of the body. And then the left foot's gonna heel toe towards the right side of your mat a few inches. Keep the figure 4 shape. Start to send it off to your left. So the outer edge of the left leg moves towards the floor and relaxes. Sole of the right foot plants. Knee points straight up towards the ceiling. And for some of us with tight hips or things going on in the low back, the floor can feel really far away. So if your right foot's not connecting with the floor, slide a prop underneath the sole of the foot, like a pillow or some blankets, until you can rest your right foot on something tangible. Adjust your shoulders. Again, notice that the chin started to jut up towards the ceiling. Kind of tuck the chin towards the chest as you relax here. So I'll give you some options with the arms. Again, you can take the elbows out wide to the side, feel that spreading across the collarbone and the chest. If you want to bind, you can reach your left hand down to the right ankle and make that connection. The right arm can sweep long overhead. That might feel like more sensation along the right side hip, right waist. Kind of play with somewhere in between. Notice how whatever it is that you're choosing is feeling in the body. And why are you choosing what you're choosing? Are you efforting to go deeper when the body is not ready? Or are you allowing yourself to be with your body as it is and supporting it where it's at? Settling in for stillness, close your eyes. Deep belly breathing. little bit longer hold, and this shape will be here for about 3 minutes. And keep coming back to your breath. Keep practicing sending the breath deep into the belly. If you're making that bind of your left hand to your right ankle, can you let it be soft? Can you let the hand be relaxed? Let's take one more deep breath in here. Breath out. Now slowly rotate the legs back through center, so you're rolling back onto the pelvis. The left knee points up towards the ceiling. One more time, squeeze that right knee into the chest. Then extend your right leg out long, relax the right heel. Extend your left leg long, relax the left heel. We're going to pause in between sides to let the body integrate, to let fresh blood flow through the bones, through the joints, through the tissue. And while you're lying here on your back in stillness, can you bring your awareness to where you're feeling sensation right now? And what is that sensation like? Is there a new awareness or a sense of energy where once it felt kind of dull? Three deep breaths here. Rebend the knees, plant the feet. Knees are pointing up towards the ceiling, feet are flat. Press down into your feet, scoop your tailbone up and under, and then set your hips back down. Keep pressing down into your right foot, extend your left foot towards the ceiling. You can interlace your fingers behind the left thigh as you begin to circle out left ankle. You can also point and flex the toe. Just add some movement. Hug your left knee into your chest, give it a little squeeze. Add a little pressure. Flexing your left foot. Take the ankle rested on top of the right thigh, close to the knee joint. Now that left knee moves out to the left side of your mat. And start to walk the right foot off to the left side of your mat. And then move the figure 4 arrangement off to your right. So the outer edge of your right leg relaxes onto something tangible. It can be the floor, it can be blankets, it can be a pillow. Support this side as you need. Same thing with the left foot. If it doesn't automatically reach the ground, slide some pillows or blankets underneath that foot. So you're allowing the muscles to completely disengage. And you're allowing the benefit of holding the shape and stillness to start to move through you. And the sensation might be more or less intense on this side. The invitation is to notice. Same options apply with the arms. You could take the elbows out wide, just relax the backs of the hands, palms face the ceiling. You can also take that bind, right hand maybe reaches down and gently binds the left ankle. Left arm could stretch long overhead. Really depends on you and your joints. Everyone's going to feel different. Everyone's probably going to look different. You don't have to look like me. Just meet your body where it is. You start to deepen the breath again as you settle in to stillness. Coming back to your breath. Can you take big diaphragmatic breaths? That means the breath moves all the way down to the belly. You let the belly fill up and expand, kind of like a baby would breathe. You see their bellies really full and expansive. And then exhale, everything softens back into the body. Keep practicing that breath. Keep coming back to it. Few more breaths here. If you have a bind of the hand to the ankle, release that. Take your time, roll the hips back through center, planting the right foot. Begin to hug your left knee back into the chest, give it a little squeeze. Extend your left leg long, rest the left heel. Extend your right leg long, rest the right heel. Allowing yourself to lengthen out onto your back. Allow yourself to pause and breathe. Really in the pause where much of the medicine happens, where the awareness occurs. Can you slow down enough to notice what feels different? 3 deep belly breaths on your back. Bending both of your knees, plant your feet. You can sweep your left arm long overhead and then roll off to your left side. Your bicep acts like a little pillow. Pause here, fetal position. Pressing into your right hand, come up to a seat. And now we'll take a seat on our right hip, and I'm not going to mirror you, so listen to the instructions rather than trying to mirror image what I'm doing. So I'm rolling my weight onto my right hip. Maybe you're still facing the top of your mat. So if you are, then your right ankle and your right knee are parallel with the short edge of your mat. You're relaxing the outer edge of your right leg. And then pick up your left foot, left knee, start to tuck it behind the right foot so the inner edge of your left knee is relaxing on the mat. So your left hip is internally rotated now, your right hip is externally rotated. And these two shapes or movements of the hips can really vary greatly in our bodies. For me, internal rotation is really challenging and external rotation is easy. Which is relatively normal for women. We tend to be more externally rotated. But sometimes that depends on how the femur bone sits in the socket. So this can be really structural and a lot less to do with your flexibility or your agility. Just know that sometimes it's the bony structure that stops us. And that's something to note and to not force. Okay, so we're seated upright here, resting most of our weight on our right hip and the outer edge of the right leg. And then start to walk your hands forward of your right shin. So you start to move more like you're headed into a forward fold over that right shin. And the left hip might pop up off the ground, that's okay. So you're going to notice here the body's going to stop you eventually. And if you're really flexible, then you might come down onto the forearms. You could stack your hands and rest your forehead on the backs of your hands. That might be possible for you, but if it's not, that's okay. You could gather props underneath the chest and the belly to bring the floor up to meet you. And you can use as many pillows, blankets, blocks, or books if you have them to create that ramp that comes up to you. So anywhere along this trajectory of sitting upright and folding forward, we'll settle into stillness. If you're feeling any sharp shooting pain in any of your joints, especially the knee, I want you to back out. That's your body telling you enough. You've gone too far. You want to avoid that sharp shooting pain. As we fold into this, if there's a lot of tension in the hips, it's kind of a physiological response. Sometimes to feel that energy, that tension rise up into the shoulders and the neck and the jaw maybe. So can you do your best to relax there? Relax the shoulders, relax the neck, relax the jaw. Keep breathing into the sensation around the hip joints. You rest your awareness there. Deep, full belly breaths. One more deep breath in. Deep breath out. Really take your time to back out of this. Palms come underneath the shoulders. Slowly lift up. And start to move the hands behind the hips. And then extend both feet forward. Stretch the legs out long. Just pause here for a few moments. Add any movement that you like. You can point and flex the toes. Move the feet side to side. You can shake out the legs. Notice how the hip feels, both right side and left side. We're doing two different things with those hip sockets, with those joints. Now here's a fun little thing to do while you're sitting here. Take a peek at your feet. Let them just kind of go. Let them really relax. So try not to have any tension in the legs, and notice what happens to the toes. If you take a peek at me, you can see my toes turn out to the sides. This is what tells me what my hip sockets are doing. My hip sockets are moving or rotating externally because I can see what's happening in my feet. So the feet are kind of like your steering wheel for the machine of your car, of your body. So it's just something, some of us have internally rotated hips, so you'll notice that when you let your feet go, they naturally turn in towards one another, or some kind of just point straight up towards the ceiling. Just a fun little thing to notice. All right, so we'll take the second side. We'll roll onto the left hip. And we'll take that shin so it's parallel with the short edge of your mat. Relax the outer left leg, the ankle, the knee, and the hip joint. Pick up that right leg, tuck it behind the left foot. And then just take a moment here to kind of sit on your left hip. The inner right knee is relaxed. You might feel like you're in somebody else's body altogether. It feels that different. It certainly feels different in my body. Sometimes I feel like I'm an 80-year-old grandma on the left side. On the right side, it feels like I'm 25 again. All right. So just keeping that in mind, you might need to prop yourself differently or hold yourself differently. So you can walk the hands forward at that left shin bone. Just take a moment to pause there, breathe. And let your body tell you where to stop. How far will your body let you fold? The mind and ego wants to get in the way and say, oh, to be successful or good at yoga, I have to be really flexible. It's not about flexibility. The invitation is to become aware, to notice your body, its limitations, and to love yourself anyways. And because of. Take 3 minutes on this side. So if you are familiar with a vinyasa practice, or if you have a yoga practice and you're familiar with the shape called pigeon or half pigeon, sometimes it's called sleeping swan, it just depends on the teacher. This is a really great way or alternative to take that shape. So because your knee, your ankle, and your hip are all on the same plane, the stretch gets to move into the belly of the muscle versus putting all of that extra weight on the knee joint. This is a great alternative because that's the purpose of the pigeon pose, right? Is to open the outer hip, the adductor, glute, the IT band, wherever the tissue is tight. If we're dumping all of our weight onto the knee joint, we're not getting into the belly of the muscle and we're causing extra stress to the knee joint. This is another alternative to that shape. Keep coming back to your breath. Deep breath in, deep breath out. A few more moments on this side. Begin to walk the palms underneath the shoulders, slowly back out, lift up. Once more, bring the hands behind the hips, extend both your feet forward. Just let the legs be relaxed. If you want to move the feet or the knees or the ankles, find some movement. Okay, so our last shape before Shavasana is one of my favorites. I call it a belly down Shavasana. And it takes some props. So ideally you have a pillow or two or some kind of a cushion and maybe a blanket or two blankets. So one of your blankets, I'll have you roll it up. It's a nice long roll, at least as wide as the hips, a little bit higher. And that's going to go towards the back of your mat. The tops of your ankles or the tops of your feet are going to rest there on that blanket roll. And then your second blanket, you could also use a hardback book, and I'll show you why. Your second blanket, if that's what you're using, you fold it into a little thicker bit of a support, and that goes at the top of your mat where your head's going to be. Okay, and then the cushion or the pillows, this is what is supporting the belly as you come down to the belly. So you get your chest supported. I'll do it from the side so you can see where I'm holding this. The belly is supported and my entire pelvis is supported. So I'm going to lay flat down on this. And it takes a little bit of adjustment, so feel free to watch me first if you haven't done this before. So you start to set down that cushion so that it supports the entire torso, the chest, but you have your chin above this so that your mouth and your nose can breathe. And then you have this folded blanket, or maybe it's a block that you're using. You can rest your forehead there. So that takes a little bit of trial and error. If you're familiar with a massage bed, when you're coming face down into that face cradle, you want your neck relatively neutral so that you can relax your shoulders and your neck. Your elbows, you can be in a really relaxed kind of sphinx pose. You could take the elbows out to the sides. And depending on how cushiony or how squishy this pillow that you're lying on is, that blanket or block might be too high, so you could also use the backs of your hands. You can stack your hands underneath your forehead, elbows out wide. So kind of play with that like you can imagine your Goldilocks. You're finding that just right bed. We'll take 4 minutes here. So if you get into this and you feel like I can't breathe very well, I need to adjust the height of the support underneath my forehead, take the time to do that. And then notice how much of your chest is on your bolster. Be sure that your chin, your mouth, and your nose are clearing above the top of that cushion. So depending on when you last ate, and depending on what you ate and how your digestion is, this can feel really intense on the stomach. It does stimulate digestion to be belly down. It stimulates ascending, descending, and transverse colon. So take advantage of that by taking those big, deep belly breaths you've been practicing all class. Really let the belly be full, press down into that bolster. So it's really important to have good gut health, a strong digestive fire. In Sanskrit, the term is Agni. Agni generally translates to fire, and when we're talking about the physical body, we're talking about the strong digestive fire. Belly also happens to be the place where we produce the majority of our serotonin. When we stimulate the belly, when we stimulate the digestion, we help stimulate the production of serotonin. Take about 2 more deep breaths here. Start to bring your palms underneath your shoulders. Really take your time. Press up into tabletop off of your cushion. You know, I should say that you could stay in that shape for your final Shavasana if you like it. So if you're feeling really good and relaxed, feel free to just head back down into that shape. We'll take about 8 minutes in Shavasana, and I'll include a little bit of Yoga Nidra. So that's the guided meditation we do lying down on our back. Take the next minute to set up your Shavasana. If you're coming onto your back, be sure that your back body is supported, comfortable, any of your props. Be sure that you're going to be warm enough. I'm going to grab an extra fuzzy blanket. It's chilly today in my neck of the woods. You might even place something over the eyes. You can block out any extra light. Find a comfortable position to rest your arms. If you're on your back, relax the back of the head, slightly tilt the chin towards the chest, the neck is neutral. Take a deep breath in through the nose. Open your mouth, exhale the air out. Twice more like that. Deep breath in through the nose. Open mouth, exhale. One more time. Begin to feel the weight of the body. Feel the weight of the body sinking heavy into the floor or whatever it is you're lying on. The weight of bones, muscles, skin, all the tissue completely relax into the floor. Feel the eyes sink heavy into their sockets. Feel the flesh around the eyes soften and release. Feel your back teeth part. The tongue widen at the base of the mouth. Tip of the tongue rests the lower row of teeth. Just relax. There's nothing left to do. Allow yourself to be. Become aware of your sense of sound. Imagine broadening your sense of sound, taking in any external background noise. You might first notice noises in the room that you occupy. And you broaden your sense of sound beyond the room that you currently occupy. What else do you hear beyond the four walls? And to bring your awareness of sound back to the body, back to the breath. Feel, see, or sense the breath moving in through the nose, down the back of the throat, filling up the belly. Reversing that, trace the awareness of the breath up the back of the throat and out through the nose. Each inhale, trace the line of awareness down the back of the throat, the spine, the belly. Reverse that line of awareness back up the spine, back of the throat, out through the nose. begin to move awareness around the body. There's nothing that you need to do. Don't even try to concentrate. Just listen. The mind trails off, that's okay. Bring your attention and awareness to your forehead, your right eye, left eye, tip of the nose, the whole nose, the lips, the space between the lips, the throat, the center of the chest. Completely relax. Awareness to the right hand thumb, index finger, middle finger, ring finger, pinky finger, the right wrist, the right elbow, the right shoulder. Completely relax the entire right arm. The right big toe, second toe, third toe, fourth toe, fifth toe, right ankle, right knee, right hip. The right waist, the right ribs, right armpit. Completely relax the entire right side of your body. Attention and awareness to the left hand thumb, index finger, middle finger, ring finger, pinky finger, left wrist, left elbow, left shoulder. Awareness to the left big toe, second toe, third toe, fourth toe, fifth toe, left ankle, left knee, left hip, left waist, left ribs, left armpit. Completely relax the entire left side of your body. Right side, left side, left side, right side. Feel the two sides of your body come together. Trace the awareness down the midline of your body. Feel your body whole and complete. 100% perfect in this moment. Begin to deepen the breath. And slowly take your time. Invite movement back into fingertips and toes. Move the head side to side. You ready for more? Stretch your arms up and overhead. Feel your biceps frame your ears. Stretch your toes away from your face, breathing into the length of your body. On an exhalation, roll off to a side, bending the knees, pause in fetal position. One full breath on your side. as little effort as possible, and there's an invitation to keep eyes closed if you can, rising up to a comfortable seat. And so you can sit on something to elevate the sits bones. Sit on a chair if you have one. Feel the sits bones rooting down. Feel the spine growing tall. Feel the shoulders stack over the hips. Big breath in. Big breath out. Left palm flat against the heart, right palm stacks on top. Bow the chin to the chest. In this moment, feel your heart beating. Acknowledge, I am here. I am alive. I am trying, and that is enough. With reverence and gratitude for our practice, to all of our teachers, past, present, future, to the teacher within your own heart. Namaste.